One World Population Day Virtual Symposium. My name is Patrick Amara. You know, on July 11th, 1987, the total population of the world reached 5 billion mark. This was a milestone in the demographic history of the world. As such, the United Nations designated July 11th World Population Day, and is observed annually by all UN member states. So we converge here for a symposium to discuss child marriage and teenage pregnancy under the theme, COVID-19 and beyond, spotlight on Uganda's adolescent reproductive health. So this afternoon, let me introduce my panel who are joining us physically in the studio, but we also have the panelists who will be joining us via Zoom on our virtual platform. My guests in the studio, I begin with the Honorable Amos Lugolobi, who is the Minister of State for Finance in charge of planning. Thank you so much for joining us, Honorable.
Thank you so much, and good afternoon to all listeners and my fellow panelists.
We also have the Right Reverend Amos Magezi, who is the board member, Faith for Family Health Initiative, and also the Bishop Northwestern College. Thank you for joining us.
Thank you very much. I'm glad to be on this panel. Good afternoon, viewers and my fellow panelists.
We have also Dr. Carol Sekimpi, who is the country director, Milestops Uganda. Thank you for joining us, Dr. Carol.
Thank you, Patrick, for having me, and good afternoon, viewers.
We will also be joined, I'll be introducing them one by one. Those who will be contributing or submitting on Zoom, shall have Dr. Jotham Musinguzi from National Population Council. We have Ambassador Karin Bovin from the Netherlands Embassy, and we have Mr. Alain Sebnella, who is the UNFPA country representative. But let me begin with you, the Honourable Minister, because the element of money is key, the element of resources. How is the Ministry of Finance, Planning and Economic Development supporting government and other stakeholders to advance investment in adolescent reproductive health?
Well, these adolescents are part of a larger program for government on human capital development. You may call it social development at the same time. Now, as government, we have making sure that we have the necessary institutional framework to deliver services relating to human capital development, where issues relating to adolescents can be dealt with. And issues relating to these early marriages that we are talking about are dealt with in those areas. Now, in terms of the institutional framework, as a ministry, you know our ministry is the Ministry for Finance, Planning and Economic Development. So finance in the context that we deal with the issues of financing all government programs. And planning in the sense that before we talk about financing, we must have the plans. And actually, these two should lead to economic development. So in short, in terms of the infrastructure, the institutional infrastructure that we have the National Planning Authority that is responsible for planning for this country, formulating the national development plans, and of course the national visions. All these falling under the Ministry of Finance, Planning and Economic Development. And then you have the National Population Council as an institution that actually directly responsible for population issues. And you have the ministry to deal with financing issues of the various plans and programs through the annual budgets. So in terms of financing, the question you raised, we actually, after we have established the plans for dealing with human capital development, which is a program, after we have identified those interventions, then the issue is looking for resources to finance them. And it's the duty of the Ministry of Finance to actually look for all the necessary resources to finance the various government interventions, including interventions relating to these adolescents.
Okay, talking about the issue of investment, if I can bring it to you, the Right Honourable Amos Magezi, I wonder what is your observation in terms of investment in reproductive health from the side of government? And you, faith-based organizations, what else can you do in investment in the same area so that you can collaborate as government and faith-based organizations?
Thank you very much for that question. First of all, I would like to begin by appreciating the theme itself, COVID-19 and beyond, and spotlight on Uganda's adolescents' reproductive health. I believe as a religious leader and representing other faith-based organizations, this is the right time to discuss this issue, because we cannot bury our heads in the sand and assume that everything is okay when the house is on fire. Because if we do, then it means that we will not have cared about them, the young people, but also it means that even we don't care about the families, it means that we don't care about our nation, Uganda. And so if we do care, we need to know that it's high time we invest in adolescents and prioritize their health. And I'm going to give 5 reasons for that. Number one, we all know that Uganda is young. The young people are the majority. So why would we neglect that? But 2, how will our country achieve the United Nations Sustainable Development Goal number 3, which talks about good health and well-being? If we keep quiet, then it means that we are not part of the world's program wanting to achieve the SDG number 3. But also number 3, we must remember that decisions made during adolescence, particularly regarding sexual and reproductive health, can have long-term impact on the young person and the human development in general. But also, adolescents' health broadens opportunities for adolescents and young people to develop skills and use them productively, helping them acquire the capabilities to make good decisions in pursuing those opportunities and offering them second chance to recover from bad decisions. And this will ensure that they are a valuable resource and not an economic burden or threat to social harmony. But if I can take even the last one, we must be reminded of other factors about the mean Uganda. Remember that teenage pregnancy stands at 25%. Remember that child marriage is the main driver for teenage pregnancy. But also remember that 28% of the maternal deaths are linked to unsafe abortions due to teenage pregnancy. Now, if we are talking about this to be information from the study and the statistics, what about the COVID-19 situation? It means that during this time of COVID-19, all this situation has escalated because you know what is happening in the community in general. And so we cannot keep quiet as religious leaders, as the government, as cultural leaders, and everyone. So there is a need to come together and work together and address this issue, because it's very important.
All right, thank you so much, Reverend Magezi. If I can come to you, Dr. Sekimpi, you know, he's talking about teenage pregnancy at 25%. That's quite high. And then we also have other related challenges, for example, in maternal health. How has COVID-19 affected, you know, women in accessing family planning services?
Thank you, Patrick. So what we observe during the COVID-19 situation, first of all, is an increased demand for family planning services. And that may be because we have more young people out of school. They're inevitably having their sexual debut, but they're not ready to become parents. And they hope that when school eventually opens, they'll be able to go back and continue. Part of the increased demand is changing the economic situations for people. COVID has affected people's income. People have lost incomes. So they rethink. Maybe they were aiming for 5 children, then they rethink and say, you know what, maybe there'll be 3, considering what is going on. And just long-term planning for people. But at the backdrop of an increased demand, we observe a limitation of access to services. And this limitation to access is two-faced. First of all, it is the difficulty of women going where services are. Part of it is the curfew, so they have shorter time to move. Part of it is the absence of public transport. So the distances can move to reach a service provider.
So I wonder, when you say there is increased demand and limited access, how do you tell this demand actually when there's no access?
Because, for example, as Mary Stokes, we have capacity to go where women are. So you see the turn-up is increasing. We see the proportion of clients that we're serving that are young has spiked from about 13% to 18% just in the last 18 months when the country has been dealing with COVID. So we can tell that the demand is high. But we know that, sometimes you work and you have to stop because the curfew time has come. We have health facilities that have been reprioritized to focus on COVID, and understandably so, because COVID is a fast killer. But that means that people who were accessing that health facility previously for their services cannot do it. The other one is people fear. Some people fear going to health facilities. There's a perception that all health facilities are contaminated with COVID. So that again presents another barrier to access. On our side as service providers is, first of all, increased operating cost. The cost of buying masks and other personal protective equipment pushes up what you need to be able to deliver services. The other one is disruptions in supply chain for commodities that we use for delivering these services. Some of these commodities are imported, and COVID is not in Uganda only, it is global. So India suffers, Uganda suffers. Kenya suffers, products are delayed at the border. So you have disruptions
So
in
assuming
service
there's no
delivery.
COVID, if there's that need, are we able to meet their need as a country?
That's an interesting question, Patrick. We are largely donor funded. And that means that we can only operate within the resources that have been allocated to us. The quick example I can give you was the goal that Uganda set for Family Planning 2020, that by 2020 our contraceptive prevalence rate would have been at 50%. We came in at somewhere around 36%. So that means that we are not able to meet our goals. And also, with due respect, the allocations to family planning as agreed in the Abuja declarations and all of that have not been met over time. So there's a bit of a mismatch between resource allocation and the need.
The good thing is that you have the Minister of Planning. So you're talking to the highest authority in the land on the issue. And your job today is to convince him so much so that when they go back in office, then they can make that happen. I just want to also to involve our panelists who are joining us via Zoom. And let me begin with Dr. Josam Masinguzi from the National Population Council. And the question I have for you, Dr. Masinguzi, is the theme for this year's World Population Day is COVID-19 and beyond, spotlight on Uganda's adolescent reproductive health. And I wonder, when you're picking this theme, what is the significance of it?
Thank you very much, Mr. Patrick Kamara, and good evening, good afternoon, our viewers. As you have put the question to me, the theme for this year's World Population Day is COVID-19 and beyond, a spotlight on Uganda's adolescent reproductive health. As you have heard from our three previous speakers, including our minister, the minister responsible for planning, the issue of adolescent has many aspects of it. Adolescent health is just one aspect of the issues of adolescence. This country has an increasing population of young people 10 to 19. It is a significant subset of a population, one that has its own challenges, but also presents the country with the opportunities. And especially when you go on and include the other younger people, 19 to 24, Uganda has a very large group of young people whom, if we can get them educated, if we can get them healthy, we give them skills, we give them jobs, and we improve the services. These are the people who are going to drive the economy of this country. These are going to be the economic engine of the country. And so paying attention to their health is extremely important. It is not important only because of what has been talked about. We want to make sure they don't get sexually abused. And in these days of COVID, and I think we have had Mary Stokes talking about it, if these kids are no longer in the schools, they are at home, they are likely to be abused, they are likely to be married off early, they are likely to start early childbearing, and with all the consequences, medical consequences of increased death, maternal mortality, but also the issue of them losing out on the education and therefore not getting skills, and therefore eventually going into poverty. Instead of our aspiration that we shall benefit from the bulging population of young people, the demographic dividend, the economic benefits that the country would benefit from if we gave these people health, education, and jobs. Now it will be the other way around. So the country will pay a heavy price until eventually be a demographic burden. So it is very, very important that adolescent health is attended to, just like we attend to the other aspects of these young people, their rights, their education, their skills, their jobs, and things of that nature. So for us in the population field, we discussed and agreed that shining a bright light on this issue of adolescents and their health, and especially during the COVID pandemic, is extremely important. And as you have heard, this is also an area that has been very much adversely affected. You've heard, and I think Dr. Sechinpi brought out very well, it's not only access to both information for reproductive health and services, but also even if the lockdown allowed them to get to the health centers, the health workers are not there. And at the same time, the lockdown does not allow them to access the drugs and the treatment they would require. So the pandemic has really put our adolescents at a disadvantage in many ways, but especially their adolescent reproductive health. And as I think it has been alluded to by the Honorable Minister, shining a bright light on this issue also means that the adolescents are not left behind. It means that the Ministry of Finance must mobilize resources and put them in the budget so that the reproductive health of adolescents of Uganda, which is a big population of our country, gets its full share, its fair share of what we are doing.
All right, thank you so much, Dr. Jotham. I'll be coming back to you. I want to cross to Karine Boven, who is the Netherlands ambassador to Uganda. Thank you so much for joining us, Karine. Development partners have been key in supporting adolescent reproductive health programs in the country. What is the EU and member states doing to advance adolescent sexual reproductive health and rights in Uganda, Karine?
Good afternoon, everyone. Honored to be here today and participate in this special and urgent platform. So to go straight to answering the question you asked me, what the EU is doing here in Uganda, we are working on increasing access to social services. As all the other speakers already observed, that's quite an issue, especially now in COVID times. And I heard one of the speakers say, the house is on fire. We cannot keep quiet. So it's even more urgent because of COVID than ever before. So what are we doing as EU, including the Netherlands? One of the objectives of our EU flagship program is focused on 3 elements. One is education, with a specific attention to fundamental education, in order to bring higher school completion rates, which is especially important for girls. Second one is health, in particular to promote equitable access to quality sexual and reproductive health services, including family planning. And the third one is social protection and livelihoods, strengthening livelihoods and resilience of vulnerable persons to reduce the risk of falling back into extreme poverty and all its consequences. And the other thing that the EU is doing is to advance adolescent sexual and reproductive rights. And then we focus on empowerment of the youth with knowledge and life skills, so they can make informed and healthy choices regarding their sexual and reproductive health. Another one is strengthening health systems to offer youth-friendly services. And the third one is transformation of social including gender values, beliefs and practices that jeopardize the sexual and reproductive health and rights of a young person. And to deliver on these objectives, the EU and its member states cooperate with the Ugandan government, but also partners with private sector, civil society, including women's movements, and traditional and religious institutions.
Okay, now you talked about providing youth-friendly services. Exactly what do you mean? And what examples would you give?
Sorry, it was a bit difficult to hear you.
You talked about youth-friendly services. Youth-friendly services. What exactly do you mean, and what examples can you give?
Yeah, it's yeah. Just to name an example, we are working together with private sector, for instance, to distribute condoms, even in rural areas. That's one example I can give, very concrete.
All right. Okay. To some people, it can be a bit controversial, but we'll get into it. I wonder whether you are distributing to a certain age-appropriate kind of group, or you just throw them at them, or there's a need they come to demanding. You think about that, because we shall be asking those areas when we continue talking. I want to bring in the UNFPA country representative, Aline Sebnella. And what is the global theme for this year's World Population Day? And Aline, how does this tie in with the Ugandan theme?
Good afternoon, Patrick and dear viewers. Happy World Population Day.
Thank you.
Honored to be here and very happy to be able to bring my contributions. So the global theme is rights and choices are the answer. Now, whether we have a baby boom or bust, the solution really lies in prioritizing the reproductive health and rights of all people. Now, it is extremely important to see how those two themes, the global and the Ugandan ones, are really linked. Because COVID really has not only exposed the weaknesses in the health systems globally, but as the previous speaker said, in Uganda as well, and hence they've created gaps and challenges in the provision of sexual and reproductive health services, and that includes, of course, family planning, but also maternal health, gender-based violence, especially for the women and girls who face sexual abuse and exploitation, and hence undermining the individual health rights and choices. So we are really concerned about the impact of COVID-19, that it has on fertility rates, but especially really, as the previous speakers mentioned, especially on the increases of teenage pregnancies and child marriages, and that has become very evident in many parts of Uganda.
Thank you so much, Alain. We are going to come back to you later. I want to bring in back the Honourable Minister, because preventing teenage pregnancy and child marriage requires collective efforts and collaboration between ministries. How do you think this is happening? Because instead of working in silos, you need to work together. Is that happening?
Thank you so much once again. I think it is important to appreciate that this is a collective effort. Mm-hmm. And it requires a cross-section of different agencies working together to actually deliver the results. Now, for purposes of planning, you need to make sure that education speaks to health, health speaks to financing, and so on and so forth. So all these different players have to get together. And I think the Ministry of Finance has that responsibility of actually bringing together in terms of planning and budgeting. We need to get all the ministries responsible, because when you talk about adolescents, you're talking about so many issues, including issues of income-related issues, because some of these adolescents actually drop out from school at a very early stage. Many of them actually drop out at P7 or slightly beyond, and we need to have interventions that deal with these adolescents. So now you're going to have a ministry responsible for skills development to come at that stage, so that these adolescents don't get lost. In the Ministry of Health, you're going to ensure that the necessary health infrastructure and services are all in place to make sure that these girls that suffer from this problem of oral pregnancies, who suffer from HIV, AIDS, are actually seriously dealt with. So you have a series of interventions, and all these have come together through the process of planning and budgeting. Of course, the limiting factor has always been the resources, you know, and this is when you get these various development partners coming in. I think she mentioned their interventions in it's called Maria Stops, you know, the various interventions. And together, you know, we deliver services that deal with these problems relating to the adolescents. So we are coordinating that effort. I think what is important is to continue talking to each other and to highlight the importance of this particular issue we are talking about. Because we all know that early marriages lead to very serious problems, one of them being the high population growth rate. You know, we have projections in terms of numbers, but when you get these early marriages, then you have a problem on the population growth rate. It means that you cannot properly plan for the population that you not envisage in the first place. So you are constrained in terms of your resource and the available resources to deal with this problem. And as you know, as Uganda, we have been borrowing very heavily to deal with the problem of the backlog of infrastructure in energy, water, electricity. All these services are meant for our population, including the adolescents. Now, when the population overshoots the projections, then it means that you have a challenge. You are oversupplied in terms of problems beyond what your capacity is able to handle.
Let me come to you once again, Reverend Amos Magezi. You know, I want to know what you are doing, because look, religious leaders, religious beliefs and principles have powerful influences on individual behavior and community actions, including health-related practices. In sub-Saharan Africa, a 2006 survey found that people trust faith-based organizations more than they even trust their own government. And as such, faith-based organizations and religious leaders have an immense opportunity to educate communities about reproductive health issues. So what are you doing on this, and how are you enhancing collaboration?
I appreciate that question. In fact, first of all, I appreciate the study to indicate that in the sub-Saharan Africa, people believe or they trust the FBOs other than they would to their governments. I think it's because of religious influence, because of what people have gone through. Africans are good at religion, and so it has influenced their way of living, and so many people would rather live by faith other than living by sight. That's why the study would qualify that. But also, coming to the ground here in Uganda, I want to affirm that we have had religious leaders and FBOs sit and address teenage pregnancy and early marriages. I would like to give 3 examples. Number one, we've had commitments which have been signed by religious leaders on adolescents' health. In fact, I would like to mention that I have one here, which I would like to mention to the viewers, that the leaders who have appended their signatures include the representative of Born Again Faith, but also a representative of Uganda Muslim Council, Supreme Council, but also a representative of Church of Uganda, but also a representative of SDA, but also a representative of the Seventh-day Adventist. No, not the Seventh-day Adventist. The Orthodox. Okay, I was looking for that. So here, this statement, when it was read, in fact, it was made in June. It was made on 8th June.
Once again, they are planning their signatures on what exactly?
On commitment to advocate for the adolescents' reproductive health, and against to advocate against early marriages and teenage pregnancies.
So exactly when they commit to advocate, what do they exactly do? Because what do they exactly do?
You know, the religious leaders have a platform which can be used to do advocacy. We have pulpits, we have congregations in front of us, and so those congregations include the teenagers, the adolescents, and so we have to speak to them. But not only that, not speaking to those alone, the parents, they have a role to play in taking care of these children. But also the government.
Reverend Amos, when these numbers increase of teenage pregnancy and child marriage, and yet we're a highly religious country, isn't this an indictment on men of faith for having, with all respect, done little?
You know, what I avoid is pointing fingers. I may point one finger to you, but these three will say, but for you, you are worse, because at least the other one, you are using only one finger. And so when we talk about collaboration, we don't need to point one finger to one person. Everyone is involved. Parents are involved, government is involved, all other organizations are involved, even the youth themselves, even the children
Reverend
themselves,
Amos,
they're involved.
Reverend Amos, the issue is also highly moral, and I suppose you're the custodians of morality in Uganda. So I just wanted to know whether that is not an indictment on those whom we trust, our spiritual leaders.
My answer to that is, we know what Jesus Christ told his disciples when he spoke to them for a long time. And he said, whoever hears my words and puts them into practice is like a wise man who built his house on the rock. When challenges came and hit the house, it didn't fall because it had its foundation on the rock. But whoever hears and does not put into practice is like a foolish man who built his house on the sand. When the challenges came, they hit the house, it fell with a great crash. Now, when you talk about the morals, is it because we've been quiet? So it's one thing to hear, it's another to put into practice.
All right.
And so we can't keep quiet. We have to keep talking. It's like the other old story the song talks about, tell me the old story, tell me the old story. Because what they tell me in the morning, by noonday I've already forgotten. As if you don't care what you've heard in the morning. So the message has come out. We have spoken. In fact, Uganda is a religious institution, a mini country, because the gospel has been preached for a long time. But the question is, has it had an impact? You're talking about the morals. We've heard the message, but have we applied it to our lives so that it would transform our lives to live a better life? The answer is no. Those who are seated in the pews, listening to the preaching, when they leave, they are the same people who go to steal the public money. They are the same people who go and rape the children. They are the same people who go and go to witchcraft. So there is a challenge of hearing, but also the challenge of putting into practice.
Thank you so much.
But that was one thing. There's another one.
Okay.
The action plans have been made in 11 districts, where we are implementing the USID and Uganda family planning activity, but also thirdly, in Uganda and Chenjojo, with the help of Faith for Family Health and PAI, the religious leaders and FBOs have collaborated with district leaders to put in place, to develop the frameworks which are aiming at teenage pregnancy prevention. And I would like to mention here that we have them here. If you want to look at them, we are not talking about theories, we are talking practicals. This is the one of Uganda, Republic of Uganda, Uganda District, Teenage Pregnancy Prevention and Impact Mitigation Framework. Of course, it talks about preventing teenage pregnancy from occurring and mitigating the impact of pregnancy when it occurs. July 2021, this one we've just finished this, but we've not done it alone. As religious leaders, we've worked with the government. Also, the one of Ntoroko, teenage pregnancy prevention and impact mitigation framework of Ntoroko district. So I would like to say that we've not been sitting.
All right, thank you so much.
We have done some work, and we're glad that this has been done.
Thank you, Right Reverend.
Thank you.
Dr. Karo Sekimpi, based on your lockdown experiences, what recommendations would you give to improve community-based access to family planning services, including for young people who may be in need?
Thank you, Patrick. And as I respond to this, the first covering statement I want to make is that COVID has changed the world as we know it. And even when we eventually get rid of COVID, I don't think the world is ever going to be the same. So on the backdrop of that is, my first recommendation is for us to continue our effort to decentralize healthcare. Move healthcare as much as possible from the health facility and take it as near to the populations as possible. We have our VHT structure, Village Health Team structure. They can help, and they live within the communities. They can help to provide, they do many things. They can provide simple family planning methods like the peel. They can map pregnant girls and find them in the community and encourage them to visit the health facility for, for antenatal care and do the follow-up. The second thing that is really in line with the changing world is that we must embrace e-health and we must embrace self-care. People are moving to the internet. Right now we're having a TV show and 3 of the participants are online. This is where the world is going, and healthcare needs to evolve as well to be able to be delivered online. And not to mention, of course, that we have to put in appropriate safeguards to make sure that our young people do not harm themselves when they take e-health. Things like contact centers, ambulance services, emergency response services, and follow-up services. The other big issue is to embrace further the role of the private sector in service care delivery. The private sector plays an important role in bridging the gap. And private sector doesn't necessarily mean marriage stops. It means a little drug shop in a village. How can we build their capacity to be able to provide services for the people around them? Now, when movement is limited to walking distance, the private sector is critically relevant in enabling service delivery at scale. And the other thing that I would not underscore is the value of communication. There's so much myths and misconception. There's so much fear around COVID-19 and related complications. So we need to do more talking now than ever before to address these risks, to address these myths, and encourage Ugandans, women and girls, to move forward and access SRHR services.
All right, thank you so much, Dr. Sekimpi. I want to quickly go to, once again, to Dr. Jotham Musimbuzi, because Dr. Jotham, you talked about demographic dividend. This is something you like to talk about, and I've heard it several times you say it. What does the high teenage pregnancy levels mean for Uganda with regards to harnessing that dividend? And will Uganda be in a position to transit to middle income status as it aspires when a quarter of the girls are getting pregnant before the age of 19, Dr. Musimbuzi?
Thank you very much, Mr. Kamara, again. And before I answer your question directly, let me agree with Reverend Magezi on what he has said. We in the population program, in the Ministry of Finance, we appreciate the strong support, guidance, collaboration, and partnership we have received from the broad spectrum of the leaders in the religious groups, but as well as the cultural leaders. And we know that our work would have been very difficult if they didn't give us the necessary collaboration and support. So I want to confirm what Reverend Magezi was saying, that this is true, and we want to encourage them to continue doing what they are doing and even to do more. Now, regarding the issue of teenage pregnancies in Uganda and the challenge of achieving, harnessing the demographic dividend, I would like to remind our listeners that teenage pregnancies in Uganda are very high. They are at 25%. 25% means that if you take 4 teenage girls who should obviously be in school, one of them is already a mother or she's currently pregnant. And you can see what that means for her education, for her ability to have skills, for her health, but also, as we have started talking about, it's not just health alone. It is how will they move in this world and get out of poverty? How will these young girls who get pregnant, who are many, how will they contribute to Uganda achieving its middle income status, which we should be entering hopefully soon? How will we achieve the sustainable development goals by 2030, which we have set our goals on? How shall we achieve our vision 2040 if one out of the four girls are going to miss out on all these opportunities? And as we have said, the demographic dividend is that opportunity, that economic benefit that a country gets if it empowers its young population. Its young population is also its potential workforce. And as you know, Uganda has a lot of young people. And if we can empower them, yes, we can get to the demographic dividend, because then there will be the engine of the economy. However, if they are going to be involved in early pregnancies, early marriages, teenage pregnancies, with all the attendant issues we have talked about, including those which can lead to death and self-abortion, young girls dying during pregnancy and childbirth, and all of these can eventually lead the country to very unfavorable negative tendencies. Instead of we celebrating, trying to harness the demographic dividend, we may eventually find that we are at disadvantage in this regard.
Dr. Msinguzi, is there some kind of a timeline on when we're supposed to achieve that demographic dividend?
The demographic dividend, I don't want to scare people, but the truth of the matter is that if you look at the Asian tigers, it took them a long time. Even for us, it is going to be for some time. But the important thing is that Uganda has started what we call demographic transition that we are seeing less deaths, and the births are also decreasing. So we have an opportunity now to start on this. And what it means is that we must start investing in those policies that we are talking about, the ones that we education, skills, jobs, good health, pay attention to these adolescents so they remain in school and get skills. And once you do that and you make sure that like the Minister of Finance and Planning is here, is the one responsible for planning, that the jobs are going to be there for these young people. We will start in about the next decade or so. We'll start really busting, we'll be benefiting from the demographic dividend of these young people. These young people will have jobs, they will have incomes, and we will reduce poverty, and the country will start prospering. We have a bigger population to get taxes from, to build infrastructure. And so that is what we are hoping we'll be able to do.
Dr. Msinguzi, very quickly, it appears for us to start benefiting in the next decade. That bus seems to have left us, because you should have invested in them maybe a decade back.
No, you couldn't have done so, because this is why we need to understand it. In the past, our mortality was still very high and our fertility was still very high. When those two are still high, the issue of benefiting from a demographic dividend, whatever you do, is not possible. It can only happen if your mortality, infant mortality, maternal mortality are coming down, but also fertility is coming down. When both are coming down, then you can put in place policies that then can drive the process towards the demographic dividend. Doing it much before does not work at all.
All right. Thank you so much. You have to stay with us, because we shall come back to you. I want to go to Her Excellency Karin Boven, the Netherlands ambassador to Uganda, and I want to ask, why is adolescent sexual reproductive health and rights such an important topic for the EU and member states? And if I can also add there, Dr. Msinguzi is talking about reducing fertility, and yet I can see in advanced countries you are in panic mode. For example, in Denmark, you know, there's just an aging population. In China and other places. In fact, there was a program in Denmark called Do It for Denmark, urging young people to be able to produce. Why is this so important to you as the European Union and Netherlands?
Thank you very much. I can't answer any specific questions for Denmark, of course as I'm the ambassador of the Netherlands. But to elaborate a bit on why Population Day is important for us as EU and also for the Netherlands, I can mention 3 reasons. And as mentioned before, the rapidly growing world population has a negative impact on the environment and development in general. And without tackling the drivers of the rapid global population growth, it will simply not be possible to achieve the SDGs. And they are already mentioned: ending poverty in all its forms, attaining good health and well-being for all, ensuring inclusive and equitable education and lifelong learning opportunities, and achieving gender equality. Furthermore, adolescent sexual and reproductive health and rights are human rights. So the EU believes and stands for human rights for all. And let's not forget that the youth themselves ask for support. They have so many questions, issues, problems, and worries. So that's of course quite a number of reasons why we should work on and implement programs on SRHR. As mentioned, Uganda's population is growing rapidly. So not addressing the sexual and reproductive health and rights of especially the youth puts countries like Uganda at risk of loss of productive future labor force and jeopardizes therefore sustainable economic growth. And this could ultimately threaten Uganda's economic, social, and political stability. So I think as we commemorate World Population Day today, it's also important to critically reflect on the underlying drivers of this rapid population growth. And again, most of the items are already mentioned. The unmet need for family planning among women and girls of reproductive age, child marriages, teenage pregnancies, and sexual and gender-based violence. And this is even more urgent, as has been said, given the fact that the COVID pandemic already has compromised healthcare systems and is creating additional pressures on the already overburdened social service delivery systems. And these observations confirm, and again, that's why we're active in Uganda on this topic, that sexual reproductive health and rights should be central in our development programs and interventions. And they are essential, not optional.
All right. Thank you so much. Very quickly, I want to go to Elaine before we take a break. Elaine, from a development perspective, why is this such a concern, if you can just explain? Teenage pregnancy.
It's been largely mentioned by the previous speakers, right? One is, of course, the biggest contributor to population growth. But the other one, Patrick, let us remind ourselves that it's also leads to complications, right, during pregnancy and childbirth. And in Uganda, it is really, teenage pregnancies is one of the leading causes of death for girls who are aged between 15 and 19 years. And so we're looking at 28% of maternal deaths are occurring among young girls. And so this is one aspect that we haven't talked about. Secondly, personally speaking, I believe it really has to do with exercising your rights, your fundamental rights as a woman or as a girl or a younger woman to choose and to make choices in your life. So we at UNFPA consider this notion of rights as critically important in development. It is your right to choose. It is your right also not to die because you want to give birth to a child, but it is your right to be free from violence. And hence, the combination of these rights, and as I like to call them, a package of rights, an integrated package of rights, is absolutely fundamental to the well-being, not only of the society, but ultimately also for the development of the nation.
All right. Elaine, Karin, Jotham, the two Amos and Caro, we're going to take a break, and we'll be right back. Welcome back. You're watching the 2021 World Population Day Virtual Symposium. My name is Patrick Kamara, and I have my panelists in the studio. Once again, I have the Honorable Amos Lugolovi, Minister of State for Finance in charge of planning. We have the Right Reverend Amos Majezi, who is the board member, Faith for Family Health Initiative, and the Bishop of Northwestern College Diocese. We have also in the studio Dr. Karo Sekimpi, Country Director, Maristops Uganda, and we have other panelists who are joining us on the virtual platform. We have the National Population Council Executive Director, Dr. Jotham Musinguzi. We have Her Excellency Karin Baven, the Netherlands Ambassador to Uganda, and we have the UNFPA Country Representative, Alain Sabnella, who are joining us on Zoom. So let me begin with you in this segment, Dr. Sekimpi, because Karin talked about youth-friendly services, and she just talked about one service, and I know Maristops, that's your area as well. Yes, 2 days ago we had a young lady on this show, and she was saying, look, they have even created for us what they call youth-friendly corners. But when they go into these corners, they are not friendly at all. If you can explain on how you are getting these services, friendlier services to the youth.
Thank you, Patrick. Youth are interesting people, and different implementation partners, different agencies interpret youth friendliness differently, whether it's free condoms or big billboards or colorful corners, so-called youth-friendly corners. But the thing is the principle. The principle of youth-friendly services are about three. The first one is a non-judgmental, respectful service. So when you have a 13-year-old standing in front of you asking for a pill, you don't ask what they're going to use it for. You ask, do you ask, where's your mother? Because by the time they take the courage to come in front of you, they have a need. So you treat them the way you'd treat any other client and provide broad counseling and help them to make their choice without being, imposing. So
if you can pause there, how in this era where we want to collaboration, how would the Maristops collaborate with FBOs on a particular issue like that?
in fact, we do collaborate with FBOs because as has been discussed.
A 13-year-old looking
Yes.
for a pill, and would you get support from FBOs?
So there are multiple silos of thought here. So when I have a 13-year-old in front of me looking for a pill, they are a client. So that is the level of service delivery. But then there's a second level where we're in the boardroom with the bishop. And I make the case. I say, Bishop, we see these girls. They are coming to us. We see these girls. They are being pregnant. Is there something you can do in terms of messaging, in terms of reducing stigma? So that's the second level. So, but what I was saying is the three cornerstones of youth friendliness is a respectful, non-judgmental service. Mm-hmm. The second one, easily accessible. The ease of access is an issue, whether it's in terms of distance, whether it is in terms of time, whether it is in terms of price. So you try and remove all those barriers so that youth can, and the other is really being non-judgmental. That's the biggest challenge with youth. They stay away when they feel judged. And then you can interpret that anyhow, in free condoms, colorful rooms, but the three issues of being respectful, non-judgmental, and easily accessible should guide the framework of...
You know, Alain there was also talking about maternal mortality. And in Uganda, we lose about 19 or 16 women on a daily due to pregnancy-related complications. And we're told the majority of those are young people who have not yet reached the age of giving birth. And I wonder why those figures have remained almost there. And yet we can talk about figures. Can imagine today there's somebody who is mourning a loss of a daughter, a loss of a sister, or a workmate, or a friend, and stuff like that. Actual people crying right now who have gone to marry. Why have we failed to reduce on that?
So first of all, I don't think the figures have remained there. I expect that because of the pandemic, these numbers have been exacerbated. Unfortunately, we count once every 5 years in the demographic health survey, but I wouldn't be surprised next time when they count to find the numbers have gone up. The second one is to acknowledge the progress that Uganda has made in bringing these numbers down. We have made significant progress. But there remain a few catchy areas that keep bringing these numbers up. The first one is health infrastructure. Over 85% of Ugandans are rural. They access their health services from a health center 3 and a health center 4. And whereas there's been progress to improve that, there are still health center 4s which don't have active theaters. That means they can't provide, emergency obstetric care. That means mothers have to be transferred for miles to the regional referral hospital before they can access a service. So we need to invest more on that front. The second area where I see a weakness is in terms of policy. There are some policies that seem to be really scary to Ugandans. The sexual reproductive health policy, the adolescent health policy. These have been discussed for years, I think 7 years. We are still trying to decide at what age should a young person receive a contraceptive. We're trying to decide, take it to cabinet, take it to parliament. But these girls are in front of us and they require help. So in the absence of policies, we cannot hold health workers accountable.
Okay. Reverend Amos, maybe this is going to be a tough one for you because, or maybe it isn't, but should we be able to give age-appropriate information on sexuality or some kind of sexuality education to the children, even in school, so that the teachers get involved and the parents teaching these things to people, so that maybe young people can have choices from an informed position?
I appreciate that question. In fact, when it comes to passing on information, it is very, very, very important. But it depends on what kind of information you're passing on and how you're passing it on and how you handle it. We are talking about packaging. You have to give the right information to the right people at the right time so that they know how to handle it. Now, teachers should talk about this. Parents should talk about this. Why? Because in the society today, children are not at home. Of course, leave alone the COVID-19 pandemic, it has kept the children at home. But before the lockdown was announced, all children were at school. And when it comes to the current situation, even the kindergarten child wants to be in boarding school because parents want to run away from the role of taking care of the children. So they're like, hey, okay, my children can be in a boarding school. You can imagine the nursery, and then primary to be in boarding, and then secondary school being boarding. Of course, university is a sure deal. They must be away from home. And so, if the information has to be passed on to the children, then whoever has the children in front of them, they need to pass on that information. That's why I'm saying teachers should play this role in passing on this information. But the question is, how do they package it? Now, when it comes to family planning, as our position as faith-based organizations, when it comes to family planning, the word is family planning. If you are not in the family, then what do you plan for? That's why we are saying family planning information should be passed on to the people in the family so that they plan for the family.
All these challenges we see are related to a weakness in the family. And I'm thinking it is not, the education we get in school may not really be helpful enough in giving us integrity, in giving us honesty, in giving us things of reliability. These things you're going to get them in a home. And it appears in the Ugandan home, there is a crisis. Yeah. So how do we make sure that the family, which is as the foundation of every human being, is anchored in those values that are going to produce a Ugandan who can add value to her community and her country?
And so what you are saying is a call to the parents to go back to their work. In the past, the parents had to have time, sit down with their children and pass on the information to them, especially at night. when they are together as a family. The parents would pass on the information to the children. And so even the little time, you see the challenge we have, you are talking about crisis in the family. What parents are saying now, and they are like, hey, when will schools open so that these children can get away from us? For them, they are like, hey, we want the children to be at school. They don't want to take responsibility of taking care of them. In fact, that's why that this situation has escalated during the COVID-19 pandemic, because children are at home. So children at home, parents didn't know what to do.
And if you can pause there, because I just right now, just seen on social media a joke that is related to what you're talking. A teacher was complaining about a child in school called Tom. And so he called the parents and, you know what, your son here is so, disruptive, is unruly, is bad behaved. Can you please come and take your son? And then the parents said, when we are having him at home and we are suffering, do we call you? you also you also suffer with him. Yes, this Carol wants something to chip in.
Yes, the other thing I want to spot, put a light on is the different contexts within which our young people exist. Many times when we are planning for them, we think narrowly. We need to be thinking the whole picture. Think about the young girl in Kamuli district, in a homestead where the multiple huts surrounding, there's no fence, she has to move 5 kilometers to the well and come back. It's COVID time, there are all these young idle men around. That is one set of girls. The other one is the mothers who are also youth. We have 15-year-olds who are mothers. So when you talk about access for young people, consider them as well. Think about my daughter, who lives in Kampala behind a big fence. There are askaris at the gate, but she's on the internet all day. She's exposed to all forms of information and connections. So what we need to be thinking about as we plan to mitigate the risk of teenage pregnancy is that our young people exist in different contexts. And we need to put in processes, policies, and interventions that address all of these. And if we can't do it for all of them, then we address for the larger majority, at least. And these are our rural young people.
Whether in rural or in Kampala, Dr. Sekimpi, we actually don't need walls of concrete around our houses. We need something else to give us the comfort and security that we need. Because if you travel abroad, people have beautiful houses, but you'll never see these concrete walls around their homes because they feel secure. Sometimes they wonder, why do we have them? Are we trying to hide that? Because actually, if you open up those walls, you may not like it what you see inside.
But they're not helping anyway.
Yes, but Honorable, they talked about preparing the youth, maybe giving them skills. And I've seen government making an effort of building colleges for skills, bit of it. But when you go in those districts, like the one I've seen or two, you find the enrollment is very low, and yet education to do, not just to know or speak like I'm doing, education to do with our hands, in my view, is the education that perhaps can liberate our country. And we seem to have neglected or not really put serious emphasis on it.
Maybe before I get to that particular question, this issue of having the basic services closer to the population, particularly to the young population. And I'll give you my own experience in my work as a member of parliament in Intenjeru North. I come across a certain parish where access to secondary education was a very serious problem, where girls after P7 have to travel several miles to access secondary education. Now, many of them certainly could not walk several miles to get to that school. And the problem is that they had to drop out of school as a result for lack of a secondary school within their means. So the provision of some of these services, I think, is going to help us to deal with part of this problem. So what I did, because they had articulated the problem and I really saw that there was a real need to establish a secondary school in that area, I used my limited resources to start a secondary school. And then I appeal to the Ministry of Education to actually support me or take over this particular school.
So, but then you need to weave it into the policy of government, so it doesn't have to take the Honorable Golovi's magnanimity for them to have a school, so that every sub-count of that nature.
That's the point I was coming to.
Okay, sir.
I did this actually several years ago. So we reduced the problem of early pregnancies in that particular area because of that intervention. Because eventually government took over. They established a big secondary school there. But now you know that the government has actually been implementing a program known as UGIFI, the Intergovernmental Fiscal Transfer. The intervention is in two areas, in terms of creating seed schools, like that one I've just mentioned. These are secondary schools, but also in the health sector, creating the health facilities, upgrading health center 2s to health center 3s, and health center 3s to health center 4s. And actually, a lot of infrastructure has been established in this area. Of course, the problem is going to be on the operational resources required to make them operate. You know, this is now going to be the challenge, the big challenge. But we are here to deal with challenges, of course. And I think that the provision of these services, health-related, educational-related, is going to help us very seriously in addressing the problem of school dropouts, the result of which we get these early pregnancies. Now, getting to your question about the vocational training, of course, we have a number of institutions offering vocational training in various parts of the country. The challenge has been most students think that by going to universities is the way to success. And they forget that you can attain success even at a lower level when you gain certain levels of skills, like becoming a mechanic, like becoming a plumber, a builder, etc., etc. And all these are offered at the vocational level. And at the vocational level, we have both the formal and non-formal. The formal skills training actually allows a student an opportunity to go further until when he gets to the university, but through the vocational route, you know. But he can even drop out at that level after attaining some levels of skill, becoming a mechanic, electrician, you know, and so on and so forth. You can attend those schools. But also, in the non-formal, we actually go to the population itself, you know, and offer short-term training of 3 months. These programs are there in the Ministry of Education. The only unfortunate thing is that I think there has not been enough intervention at the level of the parents to educate or to inform their children that this is another option offered for your success. You know, we have not told them, because the parents always require that you move from P7, you go to senior 4, you go onwards, S6, up to university as the only route. And in the end, we have so many graduates who cannot get employment. But when it comes to the skills side, factories need these people, but they cannot find them. You see, they cannot find them. We are looking for entrepreneurs who are, because many of these entrepreneurs, people who produce furniture, who do all these sorts of things, you know, they need to have the skill. Now, we need entrepreneurs now. We are providing funds through various forms of interventions, including microfinance support center. You have these Myoga programs, etc. But the uptake has the issues.
So now, Honorable Minister, your diagnosis of the problem, I think, is right. But for you, you have a responsibility.
Because you cannot be organizing with the rest of us, because for you need to organize. And actually, you're the minister in charge of planning. So how do you reverse that?
Well, I don't think that I'm lamenting, but what I'm trying to say is that, you know, we agreed at the beginning that this is a multi-sectoral problem,
Yeah.
a collaborative effort. Yes. I have noted that Mary's talks focuses largely on reproductive health issues, you know, and issues of contraceptives. But that's one angle to it. But the other agencies, the bishop just told you, they also intervene at some level. I think they need also to come in, while government also comes in to mobilize and inform the masses about all these opportunities I think we need a collaborative effort in this area. Since we are here now, today, it's World Population Day, we are here to pick lessons, which we can later put in the framework of implementation to ensure that we prioritize the issues relating to reproductive, to adolescents, and so what we do about it.
All right. Let me go to our panelists on virtual platform. I want to begin with you, Elaine, from UNFPA. You know, I've heard from Caro, we talked about the issue of resources. The minister also touched about the issue of resources. But beyond the resources, what can we do so that we have a quality population who have young and tap into the dynamism of the young people?
Well, I do believe that the big elephant in the room is unemployment of young people, and having I believe an environment that gives a chance to everyone who wants to have a chance at or go at entrepreneurship and business creation and so forth. I think that's one big area that needs to be talked about, where we at UNFPA are not the best place to provide any answers, but there are many in the UN who do, and I think that's really important. Let me get back, Patrick, to the issue of being able to choose, because you know that right combined with as the previous speakers have said, if you are pregnant and you are 14 or 15 years old, you know, your life is pretty much having limited choices afterwards. So I think this is really an important aspect for everyone. And I appreciate, really, I want to appreciate and thank the previous speakers for having spoken very naturally about what is happening to the young girls and young boys as well. So it's important that the right to be educated is fundamental, and especially for those who unfortunately are no longer in school, the right to know what happens to your body and the right to know what needs to be done, what you can do to avoid pregnancy at a young age. But to respond to your question more directly, what needs to be done to ignite? I also have a strong opinion about social change innovation. That we all, and when I say we all, it's everyone who's in a position to make decisions, who's in a position to influence, who's in a position of leadership, opens their space for young people to express their ideas, to learn, to mentor them, to counsel them. And it is something where I think we none of us has done enough, or can do more at least, right? In the UN, for example, we have, like UNFPA and many others, we open our spaces for youngsters to come and just, you know, experiment their ideas, their project ideas and so forth. But where we haven't done enough is at public leadership. I think offices that those spaces are also open to young people to learn and really to expose themselves, because that is I believe an easy way to do that, and it would create a lot of confidence. It would create a lot of opportunities and of reality checking and reality testing. And then, as Patrick and all the speakers know, my big fascination is with intergenerational dynamics, right? That generations talk to one another and listen to one another, and so that's something, an untapped potential that is extremely important here in Uganda.
I think I've ended on a point that I also want to ask Ambassador Karim Boven on that issue of intergenerational dynamics, so that young people and the older generation can understand each other. There can also be some kind of collaboration there. How can we make that happen so that in most cases you find young people in Uganda, probably they are not understood as much as they should be, and so they need to be that understanding, because the others are analog, these ones are digital. The issues are very different. We need to bridge the gap. How do we do it better?
Yes, thank you very much. And let me echo what Alain, our partner of UNFPA, already said. It's great to be here and also hear that everyone is really involved. And we're all on the same page, I think. So just to echo, it's very important today that we join efforts to raise awareness of the sexual and reproductive challenges young people are facing and explore together what we should do differently, preferably better, in tackling those challenges. And as already mentioned by all of us, I think education is key. Education is one of the focus areas where it should happen, especially primary education is quite important. And then again, put in the center of our engagement the teenage girl who is either pregnant or already given birth and in need of support to rebuild her life. And let me stress again what I've been saying before, that we not only work together with the government on these topics, but also with private sector, with religious institutions, with other leaders, cultural leaders, rural leaders, tribal leaders, and of course, peer education and intergenerational exchange of information is quite important. So we also have a role to create platforms to facilitate that, I think.
Thank you so much. The issue of education is so key, and the National Population Council, I wonder, Dr. Jotham, whether you have figures on how many secondary schools are spread in every sub-county so that girls and boys don't have to walk long distances, which can again expose them to problems. Because give them education, it is the greatest equalizer. Whether you're in Uganda, in Kampala, or New York, if all of you have had education, you're almost at the same level. How are we doing in that regard?
Yeah, thank you very much, Mr. Kamara, for that question. I don't want to go into the exact figures because they keep changing, and I think that is probably not the issue now. But the important point to make is that Uganda has invested in education, various schools at various levels. But I want really to go back to, I think, what the Minister, Honorable Rugorobi, was saying, and I think he explained it, but for purposes of stressing it, I want also to pitch it from a different angle. And that is that in Uganda, a lot of people believe that it is only university education that is going to bring food on the table. And yet we know that if people, even if they went up to secondary school and they went into vocational schools, whether it is plumbing, masonry, electrical wiring, and maybe that is where the jobs are in our country, because our country is not very sophisticated yet. When you have people who have graduated, they are graduates of various subjects. I don't want to go into that. You all know what we are talking about. A lot of them will not find jobs, but if somebody has got some certificate in wiring, they'll go in even in local towns, local trading centers, and get a job, and they will bring food on the table of their families. And then if they want to do university education, they have time, and when they are out of poverty, they have accumulated some degree of wealth, they can go to education. Further education, you can always have it many years later. So the centrality of getting the relevant education and skills for the jobs that are available in the country is extremely important. And I think that is, UNFPA representative Alain put it by saying there is the elephant in the room. The elephant in the room is for people to get the skills for the available jobs, and the jobs are there in agriculture, in the small towns, building, infrastructure, and those type of things. Not that we should not be aiming at going to university. I think that is my comment about the education in this country. And we are starting to realize that in the country. Fortunately, of course, the rather challenge, I don't want to call it bad news, the challenge is that we've got to get these policies in place in all the districts and lower levels, but also make sure that we're investing in them for a long time, consistently, persistently, and make sure we are doing the right thing. Only then shall we benefit from the demographic dividend.
Honorable Amos, this country, we are very good when we look into the policies, we are good. When you look at our programs, we are good. When you look at even government projects that you have brought, the Myoga, Bonabaga Gawale, and Prosperity for All, and even the affirmative action on girls and on women, everything seems to be, we are very good on paper, Honorable. but why are we not very good in actual things?
That's a very complicated question. But I think these are some of the areas that where we need to admit that we have not done so well. We are very good at formulating policies. In fact, some of our policies have been taken by other people, other countries. I will not mention them, and they have implemented them so well. Now, I think here we have a challenge, and we need to accept that there's a challenge here. The issue of policy implementation. People spend a lot of time formulating these policies, a population policy, etc., etc., for a policy on forestry, forest on vocational skills, you know. But when it comes to implementation, this is where the challenge is. But partly, I think sometimes it's to do with the resources to implement some of these policies. The second one is the lack of understanding that once you have formulated a policy, you need to formulate the strategies for implementing that policy or for realizing those policies. Now, very occasionally have you seen people actually moving to that second stage of identifying the interventions needed in form of a strategic paper or document to implement those policies. And this is where we are lacking, because you really need to integrate these strategies into the national development framework. Because the budget that we normally read is derived from the National Development Plan. And that is the law. If you have your policy, let's say me use the example of population secretariat, and I'm assuming that they don't take that policy to the second level of developing interventions to implement that policy, and ultimately getting those interventions into the National Development Planning Framework, it means implementation will almost be impossible, because we already have that comprehensive framework for implementing policies. So but some people have been very lazy.
You've been member of parliament for Ntengero for quite some time, and they've done a good job. But you know, as a member of parliament, your job is not only to appropriate and legislate, but also the oversight. And I'm thinking, this is where we have these 500 members of parliament spread across the constituencies of our country. Then if you do your oversight role so well, then you're able to follow some of these government programs and projects and to see which is working and which is not.
Yes, and indeed, I think we have gone a long way, because you remember that a few years ago, the issue of planning had actually been relegated to nothing. We're no longer planning for this country. Now we have restored planning in this country. And you are beginning to see that to come up with a national development plan, you actually need the sector to contribute to that national development plan. That's why these days you see that to construct the road X, that road must be in the National Development Planning Framework. And you have to see, to make sure that the manifesto is actually linked to the National Planning Framework. All these things were not there before. Now we have put them in place. The plan for agriculture has to be properly linked to the National Development Plan. So we have come a long way.
Okay.
It's not that we have been doing nothing. But now, and actually in Parliament, where I was, before I became a minister, we had demanded that there has to be a consistency, a close consistency between the budget and the National Development Plan. Because that plan is pivotal in the sense that all of us, you know, bring our ideas into that plan and implement them. Whoever misses out will have missed the bus.
All right. I think at the lowest level, maybe we should be hopeful the parish development plan or development model, is it?
It is in that plan.
That will be able to help us, because now you're bringing it to the lowest level possible.
Exactly.
All right. Probably, Right Reverend Amos Magezi, what kind of call to action would you suggest or pronounce?
Yeah, I appreciate that question, Patrick. I want to begin by appreciating where we have reached so far, and of course, with the help of people who have collaborated with FBOs. In fact, we are indebted to appreciate the government because most of these activities I've already mentioned, we have worked with the government because we've worked with the Ministry of Health, the Ministry of Gender, the Ministry of Finance, the National Population Council, civil society organizations, but also we include other development partners like PAI and USAID. But of course, as FBOs, the body that has brought together is Faith for Family Health Initiative, which we really appreciate. And so we appreciate all of them. But having said that, I would like to request that everyone, in fact, if I had a bell, I would ring it and then ring it and then ring it and then ring it and then ring it. And then after I have finished, then I would ring it again. Call upon everyone, young and old, government, non-government institutions, development partners, everyone who knows that he's concerned with the well-being of the human beings in this country should get up and work and do something so that we handle this kind of situation. In fact, I want to take this opportunity and also use this platform and this day as a confirmation of what we as faith-based organizations have already done, but also committed to do more work on behalf of the members of the board of Faith for Family Health Initiative. I would like to use this opportunity and of course by the authority entrusted to me by the members of the board, because they requested me to launch these frameworks, which are intended for prevention and also even impact mitigation of the teenage pregnancy, and allow me to launch both of them because they are intended for 2 districts, one for Ntoroko and another one for Uganda, because these are the first ones, and allow me to launch them, but also commit them to God for implementation in the name of God the Father, God the Son, and God the Holy Spirit.
Amen.
Actually, yesterday we had the Ntoroko District Chairperson,
Yep.
Mr. Williams Kasoro, articulate on the challenges they face. We
Yes.
also had the District Chairperson for Kamuli and Moroto and the cow for Chankwanzi. But I wonder, are these challenges very different? Why don't you just have one? Or maybe they are unique problems in these districts?
Well, what we did, of course, with the help of technical people, we developed a tool which applies to a specific district. Now, for example, I come from Uganda. And so we used a tool which we looked at together with the government officials, the technical people on the ground, to get facts, to get data, to get information that affects the community in Uganda. Now, if I come from Uganda, then I know the challenges we've gone through in Uganda. And so this framework has been developed to help us, first of all, address the issues which will help us now prevent the pregnancy, especially targeting those girls who have not been pregnant, but also ways of mitigating the challenges of those who have already been pregnant.
Okay.
And so I want to say that what is in Uganda may in some way be the same as what is in Ntoroko, But because we come from different areas, and of course, as one of us has already said, the environment may not be the same. The surroundings might not be the same. And therefore, what is in Uganda may be different from what is in Toroko. But because we are all rural, we are not urban, I think there are some similarities.
All right,
okay,
Dr. Sekimpi, we have talked about the girl child and the challenges and the potential and what, somehow we forget the boy child also in the conversation.
Yes, very critical. And for me, I know I am represented here as a health worker, but I have a call on my heart to the powers that be. In this COVID crisis, which I don't see ending maybe by 2024, you know, until we get massive vaccination.
Scary, you know?
Yes, mass vaccination and herd immunity. This problem is going to be here. So my heartfelt call is for the powers that be to constitute a task force and think about how to continue education in the context of COVID-19. This is education for both the boys and the girls. People talk about the idle mind being the devil's workshop. I mean, they're there doing nothing. They're going to have sex.
Okay.
And they're going to give you children. So, but, and when we talk about continuation of education, we're not just talking about Zoom, where Zoom is going nowhere. We're not just talking about radio and TV when it's not going anywhere. The Uganda National Examinations Board needs to jump on board and provide exams for those who are ready and provide some sense of progression. Our teenagers are suffering from mental health issues. They are depressed. I've had some cases of suicide during this period. So for me, my call is, you know, whereas in healthcare we are there, we have the pills and all of these things, I think it's a multisectoral issue, and education is critical.
All right.
And in the context of COVID-19, we have to find a way of continuing it with reasonable progression.
All right, we're almost coming to the end of today's broadcast. I'm going to ask each one of you, my panelists, to give us your concluding remarks. Let me begin with you, Dr. Jotham Musinguzi, if you can just, in a minute, give us your parting shot on these issues.
Thank you very much. And I think we have had a very good discussion. But going forward, I think it is becoming very clear in this COVID pandemic that the centrality of education, health, and jobs for our young people, including, of course, girls. I think you made the point, including both boys and girls, to make sure that we prepare them, we give them opportunity to be able to drive the economy of this country. I think we don't have an alternative. It is these young people who are going to be working, whether in agriculture or whether industry, in the hospitality sector. These young people must be given the necessary education, skills, health, and identified jobs for them to be able to help this country move forward during the pandemic, but also especially after that, knowing that they are the ones who are going to be driving the economy of this country as we move forward.
So much, Right Reverend Amos Majesi, your parting shot, very briefly, sir.
Make 2 points. One is to request for more support, because if we have done what we've done so far with our limited resources, now if we had more resources, what would we do? Then we'd do much, because as faith-based organizations or institutions, we have a lot of access and opportunities to serve the community, but you find we are limited. And then lastly, families, parents, take care of your children. God gave you that responsibility of having those children, and so raise them up in a godly manner, because at the end of the day, you will give accountability.
Thank you. Dr. Sekimpi, your parting shot.
Thank you, Patrick. The issue of teenage pregnancy is with us, and I'm calling upon everyone who is a stakeholder to face it head on.
All right, and let me also go again, our panelists on Zoom, and ask you, Mr. Alain Sabnella, for your concluding remark.
Well, thank you, Patrick, and my fellow panelists. I've been here now for 4 years, and I can attest to the fact that progress has been there. And progress has been there because of a couple of reasons. The first is leadership and commitment. And I really want to salute everyone who has proven that. The second one, though, is accountability. And I based on the previous discussions that took place, there is need to continue that accountability at all levels, policymakers, but also social accountability, that we hold each other accountable. And at UNFPA, our accountability to Uganda is by providing and delivering or enabling rights for women and girls in an integrated fashion. Dr. Jotham just mentioned the fundamental importance of education, and we strongly believe that we will continue to deliver those rights, the right to education, with the right to be safe, the right to choose, but also the right to good menstrual health, the right to remain free from HIV, as a package that we deliver to women and girls. And unfortunately, Uganda has not been spared from the rest of the world, that the progress that has been made, and there has been progress in the reduction of maternal deaths, has unfortunately been stymied by this terrible pandemic. But we've also seen that when we are present and when we continue to deliver services, there is still progress, or at least the setbacks are less, and that's really a tremendous show of leadership, commitment, and dedication from each and everyone, not only here today on the panel, but also out there. So thank you very much. It's a humbling experience.
Thank you, Alain. Thank you so much. And let me come to you, Karine Boven, Your Excellency, the Ambassador of Netherlands to Uganda, to briefly give us your concluding remark.
Thank you very much, and also from my side, thank you very much for inviting me. It was an honor to be part of this panel with experts and leaders. I'm just starting in Uganda, more or less, due to COVID. I haven't been around much, but I will be there in the coming years. Again, yes, I want to subscribe to what has been said, that education, health, access to information and services is key. And also, let's not forget to engage in dialogue with the young people, and not only speak about them, but especially with them, have them included in discussions and planning in the future. So in ending, I wish to confirm the commitment and support of the EU and its member states towards this fundamental topic of sexual and reproductive health and rights for all. And as has been said, especially now during the COVID pandemic, the increased number of teenage pregnancies demonstrates the critical and urgent need to enhance access to sexual and reproductive health information and youth-friendly services. Thank you so much.
Thank you so much, Karine, and thank you all our panelists. Let me ask you, Honorable Minister, since this is our World Population Day and our symposium, which is virtual, to give us the concluding remark.
Well, thank you so much, Patrick Kamara. You have exposed, you have done quite a bit, especially at this forum, to bring out various issues. So I want to thank you so much for those questions that have been you have put before us, and the responses that have been given by the various panelists, both here and the virtual panelists. I think it has been a great discussion, great conversation, and how I wish we could be meeting more regularly, other than just meeting here when we get to the World Population Day. I think we can get this collaboration ongoing even before the World Population Day. And I believe by working together, we shall be able to deal with this vice of early marriages, and other challenges that relate to our adolescents. I think we can do quite a bit by getting together, and that's what I want to encourage the National Population Secretariat to continue bring us together to deal with some of these challenges. I know they are all cross-cutting, and we need to have various teams working together to ensure that we deliver for our country. So I want to thank you so much, and let's harness the demographic dividend for the benefit of our country.
Thank you so much, Honorable Amos Rugolobi, the Minister of State for Finance in charge of planning. Thank you so much, Right Reverend Amos Magezi, board member of Faith for Family Health Initiative and the Bishop of Northwest Ankole Diocese. Thank you so much, Dr. Carlos Sekimpi, Country Director, Mary Stops Uganda. Thank you, Dr. Jotham Musinguzi, National Population Council Executive Director, for joining us from Kanungu. Thank you so much, Karin Bevan, the Netherlands Ambassador to Uganda, for your time. And thank you, Alain Sabnella, the UNFPA country representative. I think this has been good, and I thank you for the time. I appreciate your insights on these issues, but most of all, I thank you who has been viewing this program for your great company. We are a good country, we are good people, we mean well. I think we can do better. Good night and God bless Uganda.